Thank you, everyone, for being here today. And those of you watching Facebook Live and online, we will be recording this, and it will be put on DTV. It will be put on our website and also on YouTube after this conference is over in about an hour or so. So joining me today for Monday, March 23rd, 2020 is Representative David Santiago. We also have Danielle Johnson, who is the Chief Operating Officer and Interim CEO for Advent Health Fish Memorial. And we also have Rafael Ramirez, the Administrator of the Medical Center of Deltona. So first of all, I would like to go ahead and let everyone know that the city has extended its state of emergency until March 30th, and then we'll reevaluate at that time. As you may or may not know, Governor DeSantis yesterday closed all state parks. Following that, Deltona's parks and amenities were closed today as of 12 noon. I want to stress that the city cannot issue a stay-at-home order or a shelter-in-place order. This must come from the governor. We have had a lot of comments and questions about sheltering in place and staying at home. That is something that must come from the state of Florida. At this time, City Hall in Deltona remains open for business, and we have taken precautions to reduce staff's exposure to the general public. We are encouraging Deltona residents and those applying for permits and in building and services to please use our online services. You can access them at www.deltonafl.gov. You can also access code issues using the My 311 app or the link on our website. You can report code and animal issues through that app, and it will get processed, and we will have one of our officers attend to that. Understand right now that animal control is responding to emergencies only. Our city website also has updates to the health department and the CDC, the Center for Disease Control. Another thing I'd like to touch on is price gouging. Here is a list of the supplies covered under the state of emergency regarding price gouging. Protective masks used to protect you from others if you are sick. Sanitizing and disinfecting supplies such as hand sanitizer, gel wipes, cleaning supplies for surface cleaning, and all commercial cleaning supplies. All personal protective equipment, including gowns, booties, gloves, and other protective gear. If you have evidence or suspect price gouging, to report a coronavirus-related price gouging incident, call the hotline at 1-866-9-NO-SCAM. That's 1-866-966-7226. You can also report price gouging online by visiting myfloridalegal.com. That is myfloridalegal.com. I'd also like to update everyone from the latest numbers from the Florida Department of Health. All the information that I'm about to tell you comes from the website floridadisaster.org. So basically, as of 11 a.m. this morning, we have 1,171 total positive cases of COVID-19 in the state. As of 11 a.m., Volusia County has 15 total. As of last night, because numbers have not been updated from this morning's edition of the One, the following cities have positive cases. DeLand has 4. Ormond Beach has 3. New Smyrna Beach has 2. DeBary, 2. Daytona Beach, 1. And Port Orange, 1. The newest from today has not been posted, and as of last night, there was 1 posting that did not provide a city. The last thing that I want to talk about before Representative Santiago comes out are just some numbers from the same website. You can feel free to access them. It's the best website that I've found for local data and statewide data. Again, that's floridadisaster.org. So as of yesterday night, you have 57% of the individuals that are positive for COVID-19 are male, 42% are female, 1% unknown. When you're looking at your age group, I know we've talked a lot about and heard a lot about that it affects the elderly. There's a 3% number from ages 10 to 19 years, from 20 to 29 years. It's 144 people, that's 14%. 30 to 39 years, 127 people at 13%. Ages 40 to 49 years, 142 people, 14%. 50 to 59 years, 170 people, that's 17%. 60 to 69 years, 191 people, that's 19%, that's the highest percentage. 70 to 79 is 121 people at 12%, and 80 and over, 77 people at 8%. And again, these are last night's numbers since this has not been updated to reflect what's gone on today. So that's just a little bit of information for everyone. I would also like to go ahead now and bring up Representative Santiago from the state of Florida. Thank you, Representative.
Thank you, Madam Mayor. A lot of information has been shared certainly by the mayor, and there's a lot of information out there in many different media sources. And just want to assure everyone that my office is in constant contact with the governor's office and our state emergency operations team, and we're sharing as much information as we get it and as quickly as we get it. I think what I'm under the understanding is that our healthcare professionals and our first responders are preparing for the potential of within the next week to week and a half and have a huge spike in cases. So that's what we're all preparing for right now. And my ask and message is if you don't have to leave your house, don't leave your house. That's the best way we can flatten this curve and prevent more people from being infected. So again, if you don't have to leave your house, do not leave your house, and we'll be able to get over this as quickly as possible. Thank you, Madam Mayor.
Thank you, Representative. And now, Danielle, would you like to come up and give a quick update from Advent Health?
Thank you very much for allowing Advent Health to have an opportunity to come and share some words. So first off, I want to just let everybody know, stay calm, and I am convinced that the healthcare team, whether it's us or Halifax, have a lot of plans underway to protect the health and well-being of the community. I'm going to talk a little bit about Advent Health. So Advent Health in the Central Florida Division actually comprises over 4,400 beds, and of those, 600 of them are ICU level capabilities. So we have been preparing internally for what we anticipate we're going to receive externally as a result of this pandemic episode. Just some things for you to be aware of. We have a very robust infection control prevention program and an emergency management program that's coordinated by leaders throughout all of Advent Health in our division. And this is team members that include Volusia Flagler as well as Orange, Seminole, Osceola, and Polk. We work together. We have meetings every morning to talk about our preparedness across the entire division. As we look at the developments across the organization, working as a system actually allows us to have adequate supplies, capacity of beds, equipment and staffing to be able to handle the influx of patients that we may end up seeing. We have state-of-the-art operational systems and monitor areas that actually monitor things like our bed count via our mission control, which is an integral program that helps us to really monitor what's happening across the entire enterprise. So we have over 50 healthcare professionals that staff our mission control, and they help using artificial intelligence to guide our decision-making as we then have fluctuations and have to respond to challenges that we face at any of our campuses. So as we look at our preparations, things that you're going to actually see throughout our Central Florida hospitals is that we have changed some of our screening programs. So today, if you were to come to Advent Health Fish Memorial, you're going to find that we actually have a table outside of our entrances that's staffed with an individual from the emergency department, and there's a red tape line 6 feet in front of it that creates a 6-foot barrier for anybody who is coming to the hospital seeking emergency care. First thing we ask them is, what can we help you with today, and what brings you to the hospital? We then have the ability to separate patients who have respiratory symptoms from the general ED population, so that if you're coming because you've cut your finger, we've protected you for being able to access your stitches, let's say for your finger, from individuals that have respiratory complaints when they come to the emergency department. So we're already doing that. The other thing we've done is we've changed our visitation. So as of today, unless there are extenuating circumstances, we are not allowing visitors into the hospital. The reason for that is really to protect our team members, our patients, and our guests. So we have suspended what's called social visitation. Like I said, there are specific opportunities to have visitation if the case warrants it. So for instance, if there was a child in the emergency department, you know that there's going to be an adult with them. Or if there is somebody who is a power of attorney, we would give them the opportunity to be there to make decisions on behalf of their loved one. But in general, we're actually looking at every single case to determine whether or not they need to remain in the hospital and whether the risk versus benefit makes sense. You also heard that on Friday last week, the governor has suspended doing elective procedures. Those are GI procedures, surgical procedures, cardiac cath procedures, interventional radiology procedures, and we have stopped any procedures that are not urgent, emergent, or time sensitive. So I'll give you an example. If somebody has been recently diagnosed that they have cancer and to get their chemotherapy, they need to have a port put in, we're doing those types of procedures. Or if you have a tumor that grows rapidly, we're going to remove the tumor. But for instance, to have an elective knee or a hip replaced, those are the types of cases that would actually be deferred until after the crisis is over. And that's really just to protect our personal protective equipment, so that what we're able to do is make sure that our staff have what they need to be able to care for the surge of patients that we may end up seeing. You've also probably seen that there's big white tents that have been placed outside of each one of the Advent hospitals. That's really, we're not using them for anything. They're prepared for a variety of different uses. So if we have a large surge of people that need to be cared for, and we don't have room in the hospital because the hospital is full, then we would actually resort to caring for patients in that tent. So we're not using them, but it is actually there just in case and is part of our master planning to be able to handle anything that comes our way. There's been a lot of questions regarding testing. So we've seen individuals coming to the emergency department and asking to be tested. We are not testing normal, healthy people. So if you believe that you have the flu, the first place for you to go would be to your primary care physician or to a CentraCare, leaving the emergency department available for people who are clearly having life-threatening problems, such as difficulty breathing, shortness of breath, chest pain, those types of things. Now, there is testing capabilities available, but it's primarily being coordinated through the health department. So if you do believe that you need to be tested, it requires a physician's order. And from there, the physician office would actually collect the sample and it would be sent for testing. It is taking approximately 7 days to be able to get those results. So it is not an immediate result that you would be able to get. And for patients that are in the hospital, Advent Health does have some testing capabilities, but we're reserving those testing capabilities for inpatients who are really sick, so that what we're able to do is treat them appropriately for the illness that they have presented to the hospital. If there are questions that the community has that you want more information about, we actually have a hotline, and that hotline is 877-VIRUS-HQ. So that's 877-VIRUS-HQ. It's staffed by nurses 24 hours a day, 7 days a week. They can actually help give you guidance on the phone from anything from how to self-quarantine at home, whether or not you should be tested, and what to do if you're not feeling well or whether you need to go to the emergency department. So with that, in closing, just know that Advent Health is prepared to be able to meet the community's needs, and we will get through this together. Thank you.
Thank you so much, Danielle. And now, Rafael Ramirez.
Thank you, Mayor, and thank you, State Representative Santiago. Good to see you. I'm not going to repeat some of the things that have been said, but as we reported last week, Halifax Health and all the hospitals within the systems are ready to meet the demand of this virus. We want to reiterate the screening protocols, as previously said. Call your own primary care physician to discuss your symptoms first, and then if you come or when you come, we will screen you as indicated by the same protocols before considering a test. We are not testing people at random without a doctor's order or without a screen. Remember to clean your hands often, clean high-touch areas, cover cough and sneezes. Social distancing is a must, and stay home and isolate, as Representative Santiago said. Stay home if you can. Halifax system is continually looking at policies to maximize protection of patients and staff while maintaining all of the care for our patients. For example, our visitation policy is being revised to look ahead and probably continue to limit some of the visitation that is not essential to patients. Additional attention also is given to otherwise vulnerable areas like behavioral health patients, NICU patients, trauma patients, the delivery ward, and pregnant and immunologically compromised employees. While being very sensitive to staff, our system is still being extremely diligent about our personal protective gear. We want to have anything we need to treat the patients. Alternative care areas, the tents are set at our hospitals. The one in Deltona is ready to operate, and we are waiting for the patient traffic to dictate when we open that. We, as was said before, these tents are used to expedite screening and testing. Again, as was said before, the governor issued an order to limit outpatient surgeries. These are to limit outpatient non-emergent surgeries. And we are continuing to screen really carefully these patients to, in the cases that are necessary as oncology, provide the care that is needed. We have tested so far about between 70 and 80 patients so far. So that's it. Thank you.
Thank you, sir, and thank you to both of you for giving us an update from our healthcare providers. I just have a couple more things. The first thing I'd like to say is rest assured that myself and our interim city manager, Dr. Cooper, are in constant contact with He is in contact with the city managers from all the other cities in Volusia County. We have a mayor's call that is being held weekly to discuss what's going on in all of our cities collectively. We also have the relationship with Sheriff Chitwood and the Volusia County Sheriff's Department. We're in constant contact with our public safety to see the protocols, what's going on, and test the pulse of what's going on in our city. In other words, how many people are out there, what is going on in terms of any type of crime, any increase, decrease. We're also in constant contact with our fire chief and our fire department. Know that all of our public safety is there for you. They are the first responders on the scene for any type of call, and they are the ones most at risk. So we want to reassure the public that that level of service, as of now, is not changing. Also, to reiterate what everyone else has said, please stay at home as much as possible so you don't infect everyone else. Should you have any type of symptoms, you could be a carrier, you maybe have nothing. Also, don't get infected. Remember the most vulnerable people in our community, those people that are immune compromised, those people that are elderly, those people that have underlying conditions. So I would also like to say to the residents of Deltona, please be aware that any changes or closures to city activities, city business, or anything else that affects the city of Deltona and its residents will be updated by another press conference, by emails, if you're on our email list, and by checking all of our social media. In conclusion, thank you again, and Deltonans, I know that we will get through this, and I appreciate all the comments and questions that you've been sharing with the city. Wendy, did you have any questions? Al, did you have any questions? Yes, they do. As of now, the fire department is well-stocked, and this is all just going to depend on the amount of calls and how long this lasts. I mean, everyone involved in the medical, the public safety, fire departments, at some point it's going to be a strain on everyone. So right now, we're good, but no one knows how long this is going to last. Any other questions? Wendy, anything? Okay, thank you very much, and we'll hopefully do another update in a few days. Thank you again.